Hey there, it's Dr. Jim. Thanks for stopping back for another CBD related topic. Today, I'm talking about CBD and traumatic brain injury. Traumatic brain injuries, or TBIs for short, are causes of disability, hospitalization, and death in the United States and around the world. Getting treatment as quickly as possible is vital and can affect health outcomes as well as recovery. Whether medical problems are short or long term, there are numerous treatments available to help with symptoms of the injury to the brain itself. Recently, researchers have performed experiments with animals and found that CBD provides much needed anti inflammatory and neuroprotective effects after the traumatic head injury has occurred. Now, let's take a look at what traumatic brain injury actually is. Any hard strike, bump, or jolt to the head, as well as objects that actually penetrate the skull, can result in a mild, moderate, or severe traumatic brain injury. For example, a minor head injury like a concussion is considered a mild TBI, whereas a bullet that strikes the skull and enters the brain, that is a very serious and life-threatening TBI. These kinds of head injuries are common and affect hundreds of thousands of people in the US and millions around the world annually. Some people die not only to the serious injury itself, but from the many medical complications that may follow. Let's look at brain chemistry after a TBI. If during a head injury the brain twists or bounces within the skull, brain tissue and blood vessels can become damaged, leading to chemical changes that disrupt normal brain function and health. Depending on the type of injury and, of course, its severity, changes take place in neurons, cells, proteins, and enzymes, just to name a few. A damaging tidal wave of biochemicals is released during a TBI, resulting in a myriad of health problems. So, what are some TBI associated medical complications? Once a head injury has occurred, and depending upon its severity, the brain needs time to heal and to return to its normal equilibrium. Because of the displacement of the brain itself within the skull and swelling of brain tissue, several medical problems may arise, including the following: seizures, brain bleed, permanent brain damage, physical disability, shorter life expectancy, movement disorders, post-traumatic stress disorder, depression, anxiety, chronic traumatic encephalopathy, and Alzheimer's disease. And that's something we have found most recently in research. Let's look at symptoms of TBI. While symptoms of TBI vary depending upon the severity of the injury, all TBIs have commonly shared symptoms, such as physical difficulties, problems with memory and thinking clearly, emotional issues, and social problems. Mild symptoms include nausea, dizziness, headache, blurred vision, and fatigue. Moderate to severe symptoms range from hearing and vision problems, weakness, poor balance, confusion, depression, and coma. Now, TBI diagnosis and treatment. Getting an accurate diagnosis is critical, and it's also associated with appropriate treatment and prognosis. A diagnosis usually begins with a neurological evaluation, imaging tests like MRIs, and blood work. For minor head injuries, rest and over-the-counter pain relievers can be effective. If the injury is moderate or severe, surgery, medications, therapies, including physical, occupational, speech, and respiratory, as well as mental health counseling, may be required to manage symptoms and to return to health. Now, here is where things get really interesting with CBD and TBI. So, with TBI, there's a lot of biochemical reactions, this cascade of chemicals, neurons, and so on. Well, CBD is a molecule that is interacting within that tsunami of chemicals. Because traumatic brain injury, concussion, and other forms of head trauma cause biochemical changes associated with numerous symptoms that follow, researchers using animal models have discovered the neuroprotective and anti-inflammatory qualities of CBD may be helpful in post-injury treatment. Specifically, CBD interacts within and outside of the endocannabinoid system, affecting or cross-talking with various cannabinoid receptors. Vanilloid receptor 1, for instance, adenosine receptors, and 5-hydroxytryptamine. So let's look more at the neuroprotective qualities, because I say that a lot. CBD has neuroprotective, it has antioxidant, it has anti-inflammatory, so on and so forth, all of these effects. Specifically, let's look at neuroprotective effects of CBD. Researchers have also discovered that because head trauma alters many physiological functions in the brain, including within the blood-brain barrier, cognitive capacity, brain-derived neurotropic factors, and physiology of the heart, the brain-heart connection, CBD shows the capacity to influence their physiology by providing neuroprotective and inflammatory properties, anti-inflammatory properties. CBD has also been shown to regulate cerebral blood flow, protect the brain from reactive oxygen species or free radicals, and neurogenesis, or the formation of new neurons in the brain, all of which can assist in treating head injuries, including concussion and traumatic brain injury. This is really fascinating stuff. Here are my final thoughts on this topic. Although more double-blind, randomized control trials and direct human research are needed to get a better picture of how CBD may help manage symptoms of head injuries, some preclinical research has shown that CBD has both neuroprotective as well as anti-inflammatory properties and can be used following a head injury. There you have it. Another CBD topic on something relevant and important for people here in the United States and around the world. Thank you for watching the video, and I'd like to show you my new book, Living Longer and Stronger with CBD. It took me about a year and a half to write as I scanned hundreds of articles in prestigious journals, peer-reviewed medical studies, examining the effects of CBD for various physical conditions, emotional and mental issues, and neurodegenerative conditions. And I condensed all of those findings into one book. I believe that there's something in here for everyone. So if you're interested, follow the link to the book on Amazon. Thank you so much.